in Melbourne.
Okay. Well, I'm very much enjoying my visit to this HeadSpace in Sunshine. I'm joined today by Professor Pat McGorry, who probably needs no introduction, but has been so important to ensuring that there are these kind of facilities around Australia for our young people. I'm also joined by the Minister for Mental Health, Mark Butler, and by Bill Shorten, who's here in his capacity as local member. So we've very much enjoyed the visit here today. On Tuesday, when the government announced the budget, we announced a $2.2 billion mental health package. As we've made clear, it's been a pretty tough budget. There are cutbacks in the budget, and we're absolutely determined to get the budget back to surplus by 2012-13 as promised. But even in a tough budget, we wanted to make available money for those things that we really value and believe are of incredible importance to the community. I grew up the daughter of a psychiatric nurse, and I did, through his eyes, have some understanding of the state of our mental health system then. It was a mental health system that was changing from being a very closed-in system to one which was engaging more with the community. And then, of course, since my father's retired, change has continued to happen very rapidly. And Professor Pat McGorry has been one of the leading Australians driving that change. And now we understand that if you can reach out to the community, if you can have people come in to a space where they feel comfortable like this one, if we can have them access services early, then that can make a real difference to them and their lives. And through Pat's work, we know that there's no more important time to reach out and offer a service to someone than when they're young. It's when people are young that they are most likely to actually confront some of the most serious mental health conditions. But Pat's work has shown that we can make a difference if we are there helping people and helping them early. So HeadSpace is about having a good opportunity to get involved and get a service, somewhere where young people feel comfortable, somewhere where they can get a range of services rather than getting referred all around town to get the services they need. Here at this HeadSpace in Sunshine today, I've met with young people who have told me stories about their own mental health conditions and about how they got the service they needed here. They found out through school, they found out through the local public hospital, they found out through friends that this service was available here, and every one of them has talked about how much of a difference it's made. I've also had the opportunity to meet some great ambassadors for HeadSpace, young people who have used the service and who are now supporting the service by being a young person's reference group. So a service for young people can always be capturing the ideas of young people about how to get better. I'm very pleased that in our mental health package from Tuesday night's budget that we are expanding the number of these services around the country from 30 to 90. And we are also expanding the number of EPIC services which are there for young people who have some of the more profound conditions. I'll turn now to the Minister for Mental Health, Mark Butler, to say a few words, and then to Professor McGorry. And we'll just see at that stage if people have questions on mental health. And then when we've taken those questions, we might ask Professor McGorry to step to one side and we'll take questions for the day. Thank you.
Well, thank you, Prime Minister, and thank you, Professor McGorry, for being with us here this morning. Melbourne's West really, in many ways, is the birthplace of this innovative type of youth mental health service that has been pioneered by Professor McGorry, and it was such the centrepiece of the mental health package released in this week's budget. As the Prime Minister has said, we are scaling up HeadSpace services across the country in exactly the way that HeadSpace has asked us to do. We're also significantly increasing the resources provided to each and every HeadSpace service around the country, so they can do more, provide more services, innovate more, reach out to schools and other places where young people congregate to provide an even better service to young people. Mental illness is quite unique among major health conditions facing this country in the sense that it doesn't emerge in middle age or older age as most do, it emerges in youth. So we need to find services that young people feel comfortable reaching out to. And this has been the wonderful thing that Professor McGorry, HeadSpace itself and others have been working on for some years now. And I'm just wonderfully proud of the fact that youth mental health services like this were at the centrepiece of this week's budget. So over to Professor McGorry, but thank you very much for HeadSpace for having us here this day and for the work that you've been doing now for some years.
Thank you, Minister. This is a fabulous Australian story. It's absolutely terrific to see the Prime Minister here today, listening to the stories of the young people. And one of the things we had to overcome in developing this whole area, which was a missing stream of care in our health system, was a sense of confidence that if we did actually put the right types of services on deck and provide timely treatment, timely help for young people, they could actually respond and their own resilience would come to the fore. And we heard some wonderful stories this morning about that. So this is a fabulous team effort. It's a great Australian story, and it's going to make a very big difference. Also, in much broader ways, it's going to strengthen our country because it's going to mean that young people can rightfully take their place in the workforce and contribute to the strength and productivity of the country because, as the Minister just said, the big thing about mental ill health is that it does strike people in the most productive years of life. And we've just accepted that until recently. We've just been happy to sit by and watch that happen. But now I think we're seeing Australia, of all the countries in the world, is really showing the way in how that can be turned around. And I think other countries are going to be looking to us for the results of this program. So I'm very, very grateful that we've received such tremendous support. And I think I'd like to acknowledge all my colleagues and all the young people and everyone involved with HeadSpace and EPIC and Origin for making these things possible. And we've got a big job ahead of us. We've got to make sure the implementation of these decisions made by the government this week is done in a very effective way. I think that these are precious dollars, as the Prime Minister said. They've been hard won. We've got to make sure the implementation phase is done right, just the way HeadSpace has done right in the last 3 or 4 years. We've got 30 of them already scaled up in a very short space of time, working very well. They can really hit their straps now, and they can be backed up by what's absolutely essential, which is the effective rollout of the EPIC program to back them up, as the Prime Minister pointed out too. That will really transform mental health care in Australia and shrink the number of people who do end up socially excluded and marginalised around the country. And it's really the antidote to failed deinstitutionalisation, I think. We've really worked it out now, and we've got to get on with the job. So thank you very much.
Thank you. Thanks, Pat. Thank you very much. You would have heard me all week say that the budget's been about jobs and opportunity, as well as getting the budget back into black. It's also been about the things that we most value, and it's a pleasure to join everybody here today, an example of the kind of service we most value and the kind of service Australians need available to them. And we've heard some great stories. So very happy to take questions.
Prime Minister, how much